Good morning. I'd like to call the Senate Finance and Appropriations Committee meeting to order. And clerk, please call the roll.
Senator Saslaw. Here. Senator Norman. Senator Hanger. Here. Senator Lucas. Here. Senator Newman. Here. Senator Ruff. Here. Senator Vogel. Senator Barker. Here. Senator Edwards. Senator Deeds. Senator Locke. Here. Senator Peterson. Senator Marsden. Here. Senator Eben. Here. Senator McClellan. Senator Howe.
Here.
Madam Chair, you have a quorum.
Thank you. Today, we're going to be hearing the remaining Senate bills before this committee. This will be the last meeting during which we will be hearing Senate bills. We will then start working more intensely on the budget. But today is the last day we'll be dealing with Senate bills. So any that don't get out of here today will just stay on the table. We will be hearing public comments on one bill, Senator McDougall's 5113. All the other bills have had public comments during their committee of origin, so we don't hear additional public comments. However, I want to check with the clerk because my understanding is no one has signed up for Senate Bill 5113 to speak. That's correct. So we will not be having public comments this morning. So I would like to start with non-committee member bills, and the first one would be Senate Bill 5034. Senator Boysko.
Thank you, Madam Chair. Madam Chair and members of the committee, 5034 is a bill that would increase the amount of sentence credits earned by inmates for full participation in rehabilitation programs and good behavior, and we have been discussing
Senator
this.
Boysko, do you have a substitute?
Yes, ma'am, I do. I have an amendment in the nature of a substitute.
Madam Chair, I'd like to move the amendment in the nature of a substitute.
It's been moved and seconded that the amendment be adopted. All in favor, please say aye. Aye. Okay, thank you. Now we can work off of that bill.
Thank you so much. The bill provides for the earned sentence credit and also compassionate release of inmates who are permanently disabled, meaning such conditions render the person no longer a threat to society. They're terminally ill or geriatric. And with the exception of Class 1 felons in both of these components, the inmates would be considered for an earlier release, either through good sentence credits or by the parole board for the conditional release. To give you a little bit of information about the substitute, which I have brought forward as a result of many concerns from members of this body, it changes the maximum number of credits earned from 30 days to 15 days total. It adds more crimes to the list of violent crimes that exclude inmates from eligibility who would be able to earn the sentence credit program. And this expands to capital murder, human trafficking of children, child pornography, felony crimes where the victim is a minor. A large number of you made it clear to me that without these changes you would not be able to support the bill, and even though the data shows that earned sentence credits for all violent as well as non-violent offenders results in no statistical increase in recidivism, I have appeased you by putting those ins. The substitute also includes implementation language to delay the effective date to July the 22nd of 2022, in recognition of the budget realities that we are facing due to the pandemic. It also sets up a work group to analyze the costs and the savings we can expect from the bill, including the number of inmates who would benefit from the program and which correctional facilities they would be leaving. And, you know, we've heard a lot of arguments about this, a fear that people are going to go back and hurt others in the community. I don't think that's true. Earned sentence credit programs around the country are proven to help us achieve both community safety as well as giving someone a chance for redemption. You know, we have generations that have been impacted by our existing criminal justice system. The United States is at the very top of the industrialized nations that imprison people. Our incarceration rate in Virginia is much higher even than the national average. A whopping 779 individuals per 100,000 are incarcerated here in our Commonwealth, and there is clear evidence of substantial racial disparities. And we're spending more than $1 billion on our prison system annually. Opponents may claim that this is going easy on violent crimes and endangering the public, but again, that's not what the evidence shows. Research shows that it is prolonged confinement that further damages inmates, and it is counterproductive to the mission of rehabilitation and a path to self-sufficiency once the individual reenters the community. And you know, the people that we are talking about are all going to be coming back into their communities. So there are 34 other states that offer higher earned sentence credit systems than Virginia, including conservative states like Texas, my two home states of Alabama and Arkansas, as well as Oklahoma. You know, in addition to seeing reduced recidivism and working to restore social justice, states that have inactive earned sentence credit programs have seen significant cost statements. I can go into the nitty-gritty of the cost and the fiscal impact if anybody wishes, but I have a feeling that everybody's done their homework and they understand this. I hope that we will be able to support this and send it on to the floor. We are here primarily to focus on criminal justice reform. This is a huge part of it. We have significantly watered down this bill, which I'm very disappointed about. However, I do think it's important that it moves forward, and I hope it is a pleasure of the body to move this on to the floor. Thank you, Madam Chair.
Madam Chair.
Senator Hanger.
Hey, the substitute that we just adopted, is that the one that was drawn on September the 3rd?
Madam Chair, it's actually had a couple of changes. Not only has it added Class 1 felonies to it, which was not included, it also has reduced the number of days that an incarcerated individual would be able to qualify for. The original bill and the substitute that I had on Friday on the 3rd would have allowed 30 for 30 eventually. This one reduces it to a maximum of 15 days earned.
Madam Chair.
Senator Hanger.
The reason I was asking, I may not be in the right place, but the only substitute I have in front of me was drawn on September the 3rd. Is there another version floating around?
There should be.
Madam Chair.
May I ask if the one we just adopted is posted?
Madam Chair, the version we just adopted is posted, and I see that it does have a date of September 3rd on the top. So I believe this is the correct.
September 3rd?
Yes, sir. This is the correct version.
Madam Chair, actually, I worked with Connor Garskin last night, and we finalized another version of it.
Madam Chair and Senator Boysko, this is Connor Garska.
Yes, Connor.
So I was just on LIS a moment ago, and it looks like above where the September 3rd substitute is listed, there's another one that says substitute for committee offered on September 9th today. That would be the one that Senator Boysko was describing.
Thank you.
Has everyone found it?
Madam Chair,
Yes, Senator Newman.
I actually have found it, but when I click on it, I don't get anything. I don't know about others, but,
Madam Chair, I don't know what's going on with LIS, but when I clicked it, nothing came up, and then when I closed it and re-clicked it, the draft came up. So there's some sort of computer issue going on, but you might have to try twice. I apologize.
thank you.
Madam Chair, I would be happy to email it and have it printed if that's what we need to do, or someone could look at my computer. I have it pulled up
I
on my...
believe people are being able to pull it up now. Is
Madam Chair.
that the case? Yes.
Peterson.
15.
A question for the patron. Did we hear this in courts of justice?
Madam Chair, this bill went through Rehab and Social Services because it deals with the corrections
Okay.
department.
Madam Chair, maybe this is a question for staff. I thought I saw a similar bill on geriatric release in which we struck the language on permanently physically disabled. Am I misremembering that?
Madam Chair. I guess that's, yeah, it just came up. Yeah. Thank
Madam
you.
Chair, that was Senator Bell's bill that previously passed the committee, which was Senate Bill, I believe, 5018 was the number on that one, and it did remove the physically disabled on
Right.
that bill.
So my question is, if we took it off of that bill, why are we keeping that same definition in this bill? Shouldn't they marry up?
Senator Boysko?
Thank you, Madam Chair. The bill, as had been drafted, included that. The definition of that is in the system says that they are no danger to the public. And we're talking about a handful of individuals here. 18 meet the definition of disabled.
Okay.
9 qualify for
Ma'am,
years served.
I'm not disputing that. I'm just saying
Okay.
we had this debate in another committee, and we took that language out. And I think there was a reason we did so, and I'm just wondering why we're keeping it in here. And I support the bill, by the way. I'm not, it's just if we took it out of Senator Bell's bill, is there a reason why we still have that definition in here? To me, that shouldn't matter. I mean, the good times, excuse me, the credit for good days would not be dependent on that anyway. So I just don't know why we have that definition here.
Madam Chair, so
Yes, Senator.
this is two components in this bill, and if the senator wishes to offer an amendment to remove it,
My sole amendment is to make sure that this bill matches up with Senator Bell's bill. That's all I'm asking.
Okay.
Is Bell here?
Isn't my understanding, and please correct me, staff, is that Senator Bell's bill was the skinny version of this process, and Senator Boysko's has much more data collection and it's more expansive in who's covered.
Well,
So I don't see any particular reason to conform it.
Madam Chair.
Well, if you want my vote, you're going to want to conform.
Madam Chair, in our last meeting, when we were working on the other substitute, I recall that we did entertain a motion, not the total bill, but just the section dealing, this first section here, to conform it just in this section. And that would seem appropriate to entertain that same amendment that Senator Peterson was suggesting.
I'll offer that amendment. I think that in order to make this consistent, and I don't think it means any harm to the bill, but the definition of permanently physically disabled, I don't think is relevant to what Senator Boysko is trying to accomplish, and we already rejected that for the bill where it was relevant. So I make that motion.
A second.
It's been moved and seconded that that section be removed. Call the roll, please.
Senator Saslaw. Senator Norman. Senator Hanger. Senator Lucas.
No.
Senator Newman. Senator Ruff. Senator Vogel. Senator Barker. Senator Edwards. Senator Deeds. Senator Locke. Senator Peterson. Senator Marsden.
Aye.
Senator Eben.
Aye.
Senator McClellan. Senator Saslaw. Senator Howe.
No.
Ten ayes, 4 nays.
10 ayes, 4 nays, the amendment passes.
Madam Chair,
Yes, Senator Marsden.
just one thing to add to Senator Boysko's testimony. I went through a similar experience at the Department of Juvenile Justice, putting one of these early release incentive programs in place. There was market improvement in the juvenile system. They're called wards, in ward behavior. It allows the staff to focus people around their behavior and their future goals of getting released. It fits in with reintegration into the community, and it all kind of meshes up to make the prison experience one where people are leaving our penitentiaries with a focus on good behavior and not just having waited the system out. And this is a very important part of this bill, not to be overlooked. Thank you.
Thank you. Anyone else have a comment or a question? Senator Norman.
Yes, ma'am. I have an amendment to propose that I have reviewed with the senator, and if Lisa has that and would be kind enough to report it.
Madam Chairman, the amendment would add a fourth enactment clause to the end of the bill. The essence, and then I'll read it out, is that Department of Corrections will report annually to the General Assembly as to the number of inmates released under the provisions of this act who then subsequently reoffend, including the original offense as well as the subsequent reoffense. I can read the specific enactment language if you'd like. That would be what the enactment does.
Please read it.
So, it would be included at the very end of the bill, a new number 4, that the Department of Corrections shall report annually by July 1 to the General Assembly regarding the number of inmates released pursuant to the sentence credit amendments set forth in this act who commit an offense subsequent to release that causes the offender to be recommitted to the Department of Corrections. The report shall include the original offense for which the inmate was convicted as well as the subsequent charge that caused the recommitment.
Thank you.
Madam Chairman, the proposed amendment is not intended to do any harm to the bill and does not. It's just going to give us some empirical data and report back to us. And as I said, I reviewed it with Senator Borsco.
Okay, and are you moving the amendment? Okay. Is there a second for the? It's been moved and seconded. Yes. Senator Abbott.
If I could ask the Senator Norman a question. Do we already study for recidivism any of that information? I mean, I think we should be getting information on that anyway, do we? Do you know? On who recidivates and who doesn't?
Madam Chair, we could ask Caitlin Kilpatrick, staff, to see if she knows. She should be on the call.
Okay, Caitlin.
Madam Chair, I know DOC studies recidivism based on a 3-year cycle, and DOC is also on the call, so they may have more specific information.
I couldn't actually hear you, Caitlin.
Madam Chair, I think Caitlin said some information is collected, but that DOC is actually on the phone call, a representative from DOC, so that we could ask DOC more specifically.
Okay.
If their representative could come on.
Okay, could the DOC representative answer the question, please?
Hi, good morning, Madam Chair. My name is Jeremiah Fitz with the Virginia Department of Corrections. And to answer the question, we do track recidivism. As Ms. Kilpatrick said, we track it so that we are, that's what builds into our recidivism rate that we're tracking and that we report out on annually. In terms of the specifics, as far as all the crimes that are related to this bill, we would be able to track this information through our research unit.
Good, thank you. Actually, as I remember, we're either the best or one of the best 3 states in the country in terms of having a low recidivism rate. We're number 1? Good. We're number 1, even better than 3. Okay, so we have an amendment on the floor. Is there further discussion of the amendment? All in favor of the amendment say aye. Aye. Any opposed? The amendment's adopted.
Madam Chair,
Senator Newman.
I don't know if this is a question to Senator Boysko or to staff, but I'm just wondering which of the charges of murder are still included in this bill? In other words, I know the first-degree murder is out, but what are all the people that commit murder that will still be in and be available for a substantial reduction in their penalty?
Madam Chair, Charles Quagliato from Legislative Services should be on the line to answer that question.
Okay, Charles.
Good morning, Madam Chair. So the substitute contains 2 different provisions dealing with murder, and it captures both capital murder as Class 1 felonies and first and second degree murder and voluntary manslaughter. Those are acts of violence as defined in 19.297.1. So it basically captures all of the murder offenses and voluntary manslaughter.
So, Madam Chair.
Yes, Senator Newman.
So that issue was changed when it came to the substitute. Is that correct?
Madam Chair, Senator Newman, that is correct. If I remember correctly, the version prior to this did not include Class 1 felonies specifically, which was the capital murder offenses, and those were included in this substitute.
So, Madam Chair, as I understand it, then as a result of the one we just got, there will be none of the murder statutes will still be in there beyond voluntary manslaughter. Okay. Thank you, Madam Chair.
Are there further questions? Is there a motion on the bill as amended? It's been moved and seconded the bill as amended be reported. Please call the roll.
Senator Saslow. Senator Norment. Senator Hanger. Senator Lucas.
Aye.
Senator Newman. Senator Ruff. Senator Vogel. Senator Barker. Senator Edwards. Senator Deeds. Senator Locke. Senator Peterson. Senator Marsden. Senator Eben. Senator McClellan. Senator Norment. Senator Howe.
Aye.
10 ayes, 4 nays.
10 ayes, 4 nays. The bill is reported. The next bill is Senate Bill 5038, Senator McPike's bill. Oh, Senator McPike, your bill is up.
Thank you, Madam Chair and members of the committee. Senate Bill 5038 is what's known as the Marcus Alert Bill. The bill sets out, and I'm sorry, Madam Chair, we have a substitute.
It's been moved and seconded the substitute be adopted. All in favor, please say aye. Aye. Any opposed? It's adopted.
Thank you, Madam Chair. The substitute before you reframes some of the model after a national model called Crisis Now. It also better aligns with the work that this committee has done in terms of STEP Virginia, providing a framework for the setup of the 24/7 call crisis center, as well as a framework to be developed by stakeholders for a mobile crisis and/or community response team to deal with the myriad of different issues, whether it be mental health, behavioral health, substance use disorders, brain injury, or other incidents requiring mental health expertise in the response framework. The bill calls out for DCGS and Department of Behavioral Health and Developmental Services to convene stakeholders by July 1 of 2021 to work out both the call center framework as well as standardized MOUs between mobile crisis teams as well as localities, recognizing that there are evidence-based models to be applied, and getting the experts at the table is critical to this process, including emergency management, brain injury stakeholders, racial equity stakeholders, and developmental disability stakeholders. And so there are many different elements of this framework as we set this up in Virginia. Additionally, based on feedback from stakeholders, a number of different things are recognized in the bill. There are sort of two recognized models, one of which is a mobile crisis response model, as well as a co-response model defined in the bill as a community care team. Just recognizing that communities have slightly varied approaches, but the goal is that the stakeholders have a standardized framework and objectives for the delivery of these critical mental health services within our communities. As you know, in fact, this past summer, we had in our Rehab and Social Services Committee, Sheriff Stolley present data that roughly 80% of his inmates in the jail are mental health, require mental health treatment. And the overall goals and objectives of this bill, as you see in the substitute, are early diversion, and early diversion to the critical care that is needed, whether there are many different requirements and aspects of it, but it's critical that we get the early intervention of care to those who need it that is trauma-informed and evidence-based. Another element added to the bill is the creation by July 1 of 2021, a 911 database that would be voluntary for family members if they have a son that has autism or any other potential issue that they want flagged as a part of the database, that this be included as a part of a stakeholders meeting and discussion. We found this to be an important missing link of potentially valuable information to first responders, whether it be on the mental health system, whether it's call coming through the 911 system. It's an early flag, an indication of the need potentially for mental health services rather than a traditional response. So the more tools we have at the table, the better off our outcomes can be. The overall deadline, Madam Chair, is that the Call Crisis Center, that it's already in line with Virginia STEP, portions of which are in the budget, and a portion is unallotted in the 2022 budget, would be to set up the Call Crisis Center by July 1 of 2022. This is sort of an early critical step in the framework to achieving the goals and objectives of creating a more robust mental health response system in Virginia, Madam Chair, and happy to answer any questions.
Are there any questions for Senator McPike?
Madam Chair.
Yes, Senator Newman.
I don't know if Senator McPike knows the answer or not, maybe staff does, but I noticed that we've gotten substitutes, and there is, strangely, in the cost report that we get, fiscal impact, that it depends on how the bill is interpreted, and right now it looks like just the DBHDS portion is going to be about $29 million. Is anything in the substitute, and I'm talking about in FY22, in FY23, $34 million, is there anything in the substitute that has changed those numbers?
Madam Chair, I would ask that Mike Tweedy on our staff respond to
Mike.
that. Yeah, Madam Chair, hopefully you can hear me. To Senator Newman's point, so those estimates, I think, come from the previous version of the bill, which was basically also had the big component was the co-response teams. And so I believe that was DBHDS's, their best estimate of all CSBs engaged in that process. So the substitute, the job adopted that Senator McPike offered, basically provides more discretion, I think, on how locals can implement, whether it's the type of team that they need in their community. So I think, so that fiscal impact sort of becomes more of a local impact, even though it will likely be supported by the state through the CSBs. But we don't have a fiscal impact statement yet on the substitute since it was just adopted today. And since the kind of the actual date when localities are required to implement this is July 1st of 2022, that impact is a little bit more delayed now. But we should, I think the way that the substitute is designed, by July 1st of 2021, when the written plan is developed, there should be a lot better information as to what the actual fiscal impact would be.
Madam Chair, so if I understand,
Senator Newman.
Sorry, Madam Chair. So we don't know now exactly what the DBHDS cost will be, and I don't see where we know exactly now what the local government cost will be as well. So that, I guess we'll get that as it goes through, but right now it doesn't appear that we know what those costs are as the substitute's gone through.
That's my understanding, too. Is there a further question?
Madam Chair,
Senator Hanger.
I guess more of a statement, I guess, that this initiative obviously has merit. From my viewpoint, not knowing the costs and the fact that we've had to unallot some of the monies for STEP Virginia, that it may be premature to do this at this point because we're restrained by the amount of funds we have available. And from my viewpoint, our monies would be better applied right now in the crisis intervention teams as opposed to standing up something new at this point. That's just my thought.
Madam Chair?
Senator McClellan.
Yeah, thank you. Speaking to the bill briefly. I appreciate the Senator Hanger's concern about the cost, but I disagree that we need to wait because for too long, for over 2 years, advocates here in the city of Richmond have been pushing for something very similar to this bill. Because too often when someone is in a mental health crisis or has an intellectual and or developmental disability and police are the first ones on the scene, particularly if that individual is from a marginalized community, just that officer's very presence can be escalating in the middle of that crisis. And if we don't begin to move towards a model where a trained mental health professional whose sole job is to de-escalate that crisis and deal with that crisis, and we leave it just to law enforcement to do that, more and more people are going to either be harmed or killed. And this is a bill where we're not responding to what's happened in other states. We're responding to events that have happened right here in the Commonwealth. I wish this bill went farther, and I feel compelled again to speak on behalf of Princess Blanding, who there are a couple of issues in this bill we're hopeful can be addressed, dealing with the presence of the police officer still. But this moves the ball forward on a very important issue that Virginians have been fighting for at least, and in some cases more than 2 years. And I hope that we will continue this conversation to make this bill better, but at a minimum, we voted out of committee today. Thank you.
Madam Chair.
Thank you. Senator Deeds.
Could I ask Mike a question?
Mike?
Yes, Madam Chair.
Okay, we have $135 million of behavioral health money that's unallotted. We're adding around $29 million to that I guess if we pass this bill, we'll put it at the front of the line. We've also got a couple of CIT requirement bills coming up. How much are those going to cost, and where is CIT training a step toward Marcus Alert, or is it something completely different from Marcus Alert, or what? Tell me how these things fit together.
Madam Chair and Senator Deeds, so I think what Senator Pike was working on in this substitute was actually trying to align current and past efforts that the state has already been engaged in. So when specifically CIT training, of course, that's a model that supports this effort as well. While in some cases you may not need you may still need law enforcement to respond. The idea that if they have the CIT training, it's a higher likelihood of a better outcome with someone with mental illness. So I think they support each other. What I would say is I think it's aligned to, with regard to crisis services as part of STEP Virginia. One of the things that DBHCS is currently doing is developing the call center, which I think does sort of align with what the bill is trying to do. So, I mean, I think they're complementary. I think from the fiscal impact standpoint, I think what you're going to see more in the first year or two are probably costs related to staffing to assist the agencies to develop the protocols and the frameworks for all this. And it's more likely you'll probably see more impact on DBHS and the CSBs in the next biennium. Hope that helps.
Madam Chair. I appreciate that. I'm just trying to figure out what the actual cost in this biennium is going to be for this bill.
Madam Chair. Thank you, Madam Chair. If I can respond, what the bill really does is the call crisis center is the fuller step. And so you see in your existing budget, which is unallotted in the second year, was $4.7 million. So, as well as I think some supplemental staffing in terms of the stakeholder work group that is required in the bill. So it's really clarifying a coordination between law enforcement and mental health. And this is a critical early first step to do any further step beyond this within the system. And so these are, the bill and substitute is written to address what you had already approved within the budget, a portion of which was unallotted. I think before the committee, it's important to consider the unallotted amount of $4.7 million. Subsequent build out is a separate discussion in terms of full capacity. Certainly the House has a different version, which I'm supportive of, but the substitute right now is really what was in the prior budget and realigning some of the efforts to the Virginia STEP program, or STEP Virginia rather. Thank you, Madam Chair.
So Madam Chair.
Senator Deeds.
If I could ask Senator McPike a question. So you're telling us right now that even though the Finance Committee staff has said this is going to have a $29 million price tag, it's only going to cost us 4.7 of which is already in the budget, and the rest of it's just something that's going to happen in future years?
Madam Chair, yes, the fiscal impact was on the original bill, which has ambiguity in terms of the stand-up of mobile crisis or co-response teams. That is now beyond in the out years in terms of creation, nor does the bill mandate it. And so it really is about leveraging the capacity as well as the information, getting in place the best practices. There are many communities that have components of this, but it really is starting to tie in and connect the dots between the call crisis center and law enforcement as well as local resources. And so it really is, Madam Chair, and to Senator from Bath's question, at this point down to the stand-up of the call crisis center as well as the supporting stakeholders to make sure we get the best practices in place.
Madam Chair?
Senator Barker.
Yeah, just to follow up and reiterate some of the points made by Senator McPike. I think what we have here is a situation where there was an aspirational bill that was proposed, and that got the price tag of the $29 million that was there. What is here in this particular bill at this time with the substitute that we've adopted, that we just ratified, as what we're looking at, it's a very modest, relatively modest expenditure of $4.7 million, which was already in our budget that we passed back in March, and which we can deal with as to reallocating those funds. And the significant difference is the flexibility that is in the bill right now as it relates to what happens long-term and the planning for that and the opportunity for localities and the mental health system to be involved in developing what might need to be there at some point in the future, all of which would go well beyond this biennium. And a positive step, something that we can move forward with, and something that we can be able to address the amount of funding that is necessary, the $4.7 million here. Thank you.
Thank you. Is there anyone else? Is there a motion on the bill? It's been moved and seconded that Senate Bill 5038 be reported. Clerk, please call the roll.
Senator Saslow.
Aye.
Senator Norman. Senator Hanger. Senator Lucas. Senator Newman. Senator Ruff. Senator Vogel. Senator Barker. Senator Edwards. Senator Deeds. Senator Locke. Senator Peterson. Senator Marsden. Senator Evan.
Aye.
Senator McClellan. Senator Howe.
Aye.
Ayes 10, noes 4.
The bill is reported on a vote of 10 to 4. Okay, see, next non-committee member is Senator Hashmi. Senate Bill 5051.
Good morning. Thank you, Madam Chair and members of the committee. I believe there is a substitute that came out of the Committee on General Laws.
Madam Chair.
I'm sorry, I was distracted. Senator Hashmi, could you repeat what you said?
Yes, Madam Chair. There was a substitute that came out of the Committee on General Laws.
Madam Chair, we don't have to readopt the substitute. That is what's before us.
The substitute is what's before us.
Thank you, Madam Chair. Last week, I shared on the floor during morning hour the story of Claudia Taylor, mother of 3 young children, who is a certified nursing assistant and counselor, who faces reduced income because of COVID and thus also faces eviction. Her story was highlighted in the Richmond Times-Dispatch in an appeal to us in the General Assembly, and it was made by over 50 organizations throughout Virginia. This appeal asked us to take action. Ms. Taylor is simply one face of this looming crisis, and across the Commonwealth, nearly 262,000 households are at risk of eviction, and these include close to 134,000 households with children. Evictions would affect a total population of between 300 and 741,000 Virginians. We know that we need to do something to assist tenants. We also need to assist our property owners so that we can forestall the rent shortfall that is estimated to be between $169 to $370 million. SB 5051 seeks to keep families and children safe during this pandemic crisis by placing a moratorium on eviction. This moratorium ensures that families who cannot pay rent can remain safely at home. Eviction would occur only in those instances of criminal misconduct. This bill also works in coordination with the payment plan option, SB 5088, that was recently passed by this body. This bill is meant to support those families who cannot effectively engage in a payment plan option because of extremely restricted income. The bill directs households to make use of the rent and mortgage relief program, and it requires tenants and property owners to work together to seek rental assistance. I ask that this committee consider this moratorium in the context of our unprecedented crisis. We're not just facing an economic crisis for a large portion of our population, we're facing a healthcare crisis. Destabilizing housing for hundreds of thousands of families contributes to the broader expansion of this healthcare crisis. And additionally, destabilizing households increases the mental and emotional trauma for thousands of children, further impacting their education and access to stable learning resources. And for these reasons, I ask that this committee report this bill so that it may be heard on the floor of the Senate. Thank you, Madam Chair.
Madam Chair.
Senator Barker.
Yes, Madam Chair. I was chair of the General Laws Committee, and we reviewed this bill and actually deferred consideration here in the Finance and Appropriations Committee so that an effort could be made to try to pair up this bill with language that is being proposed in the budget itself and was part of the introduced budget by the governor. There's been some further revisions to that. There is no change in this bill, and there is not a consistency between the bill and the language that's in the budget. There's also a lot of moving parts. There's been the CDC action as related to evictions. There's been change in proposed language and some with the administration meeting with some of the stakeholders and what they would propose now as to adjustments for that language. And there are clearly some other factors that are driving the issues that we have now. What I think that would probably make the most sense is for us in the Finance Committee here to be able to work on all this, starting with the language that's in the budget. And if we pass this bill by for the day, it leaves it in the committee, and there's an opportunity to bring it back up if we want to do so at any point. So what I would do at this time is make a motion that we pass this bill by for the day, and that we will follow the path of working on the budget language and then determining how we handle this bill.
It's been moved and seconded that the bill be passed by for the day. All in favor, please say aye.
Aye.
Any opposed? Bill's passed by for the day.
Thank you.
The next bill, well, we have two bills that are similar and I want to do together, and one of them is Senator Edwards' bill, so I'm going to postpone hearing that bill till hopefully he gets here. So next up would be Senator McClellan, Senate Bill 5118.
I'm sorry, Madam Chair. We have a substitute for Senate Bill 5118. No, not a substitute. We have a line amendments.
Madam Chair, this is Connor Garska from DLS. I can read out the amendments if you like, but I'll describe conceptually what they do first, just so you have a baseline. So the amendments move back the date of the SCC's report from November 2020, as it is currently in the bill, to January 2021. It adds a provision under which the SCC can allow jurisdictional utilities to use a rate adjustment clause or a change in their base rates for the recovery of bad debt obligations, late fees, and prudent implementation costs. And the SCC can use any applicable earnings test to determine that. And then it removes mandatory reporting by municipal utilities. So I think there still are available reports for if there's a request from the General Assembly committees, but mandatory reporting for municipal utilities is no longer in there. And those amendments would be available on LIS, but I can read out the actual text of the amendments if you'd like. But.
Yeah, Madam Chair, I'd like
Senator McClellan.
I'd like to move the amendments and then sort of speaking to them. Madam Chair, with these amendments, what this, and first I want to thank all of the stakeholders. After several conversations, we now have, with these amendments, a bill that all relevant stakeholders agree to. I am not aware of any opposition. And with these amendments, what the bill will do is codify, essentially, the orders issued by the State Corporation Commission that require utilities under their jurisdiction during a disconnection moratorium for non-payment to offer a payment plan of up to 12 months. It is very similar to the payment plan already ordered by the Commission. It then requires those utilities to report certain cost information that they are already reporting to the State Corporation Commission. And then the Commission will provide that data to us, the General Assembly, so that if the cost recovery mechanisms that are in the bill are not sufficient, we can take action. This codifies it for this current moratorium, but also puts in place if, and hopefully there won't be, but if there is ever a similar moratorium due to a declared state of an emergency due to a health pandemic, it sets the guidepost of here's what's going to happen if we're in that situation again. The cost recovery language basically says that the Commission will allow for timely recovery of the costs associated with non-payment of bills, suspending late payment fees, prudently incurred implementation costs for the payment plan, and the data collection. It gives the utilities to the discretion to seek that through either in their rate cases or through a rider, but they still have to prove that those costs were prudently incurred. And it gives the commission the ability, if it feels it appropriate, to look at that utility's earnings to see if, based on their earnings, they can recover those costs. For the municipal utilities that are not subject to the SCC's jurisdiction, it basically says that upon request of the chairs of the relevant committees, they will provide data on their uncollectibles as a result of COVID. And the reason we did not require cost recovery and or data collection from them is they're going to seek any cost recovery they need from the governing bodies that regulate them under a public process subject to the Board of Supervisors or the City Council in those areas. But to the extent they think they need more from the General Assembly, we should have the ability to require data to prove to us they need more. And so with these amendments, again, this bill will help residential customers spread their debt over a period of time so that they don't have to pay it all up front when the moratorium ends. And with that, I hope we will adopt the amendment and report the bill.
Sorry, my mic wasn't on. All in favor of the amendment, please say aye. Aye. Any opposed? The amendment's adopted. Is there a motion on the bill as amended?
Madam Chair,
Senator Peterson.
ask a couple questions of the patrons.
Yes.
And Senator McClellan, just making sure I understand this. So basically, we're going to have a moratorium on disconnections for how long? How long does this last?
Madam Chair, this bill does not impose a moratorium. This bill says that if there is a moratorium, which there was imposed by the State Corporation Commission, and there is a separate budget amendment that will determine whether there is another one. But this bill in and of itself does not impose a moratorium at all. It says that when such a moratorium ends, the utilities will offer a payment plan to spread the debt incurred due to that moratorium over an up to 12-month period.
Okay, I'm sorry, Madam Chair, I had a hard time hearing, but so this does not declare a moratorium. Well, who does declare a moratorium?
So the State Corporation Commission has, or this body. Currently, there is a moratorium in place that was imposed by the State Corporation Commission that is set to expire September 16th. There is a proposed budget amendment that would extend that further, but this bill does not impose a moratorium at all.
Okay, further question, Madam Chair.
Senator Peterson.
So in essence, what we're saying is that there is a moratorium, whether it's imposed by the State Corporation Commission or by executive order or by the legislature. During that time, if somebody doesn't pay their utility bills, they go into this repayment plan, and to the extent it becomes a default and the utility pays, provides free services for 6 or 12 months, that then is just spread across the rate base. Is that essentially what we're talking about?
Senator McClellan.
So it's two separate answers. One, it does say if there's a moratorium, when it ends, that the debt incurred will be paid over an up to 12-month period. And then it provides that if the utility seeks cost recovery at the State Corporation Commission, they can do that for prudently incurred costs in either a rate case or through a RAC or a rider. It doesn't mandate that they recover those costs. It gives them the opportunity to ask the commission to let them recover prudently incurred costs.
Further question, Madam Chair.
Yes, Senator Peterson.
But if there's going to be a rate case or a rider or some other recovery charge, don't we need to have some guidance to the State Corporation Commission based on what criteria they're looking at? I mean, listen, I'm well aware of the excess earnings from the rate freeze that we had 5 years ago. I was the first person to speak on that. But are we saying that that money should be held aside as an auxiliary fund for these folks? Or are we saying that the State Corporation Commission is just going to kind of make up their own decision here?
We don't address earnings in this bill other than to say, let me back up. So the way this bill is written, a utility at their discretion could file either as part of a rate case or a separate case to seek a rider to recover these prudently incurred costs. And they would have to, using traditional standards of rate making and the procedure well known at the commission, they would have to prove those costs were reasonably or prudently incurred. And then we give the commission the ability, if they see fit, to look at their earnings, that utility's earnings, to figure out, are the earnings sufficient to allow them to recover those costs? So that is what the bill does. It does not prescribe you have to use their earnings to pay it back. It does not prescribe sort of, other than saying you use traditional standards of rate making or riders, you figure out were they prudently incurred, if so they can be recovered, and you figure out whether it's better to do it in a rate case as requested by the utility or through a rider as requested by the utility.
Is there a further question?
Madam Chair.
Yes, Senator Marsden.
Thank you, Madam Chair. I wish to thank Senator McClellan for hanging in on this very tough issue. It was a tough nut to crack. I think this takes care of the problems I know that the co-ops had with this, who do not have the deep pockets that a Dominion Power does. And I think it also deals with some of the concerns that the Appalachian Power Company had. And so I move the bill be reported.
Well, your bill's the last one.
Madam Chair,
Senator Newman.
I just want a point of clarification. Last meeting, as I recall, we took the municipals out. Are the municipals still out with everything that we've done?
Madam Chair, yes, the municipals are out, except if...
For reporting?
Yes, upon request of the chairs of Finance and Commerce and Labor, they would have to provide cost data as outlined in the bill, but other than that, this bill does not apply to the munis at all.
Great. Thank the Chair. Thank you.
Are there further questions? Is there a motion on the bill? It's been moved and seconded that Senate Bill 5118 be reported. Please call the roll.
Senator Saslow. Senator Norman. Senator Hanger. Senator Lucas.
Aye.
Senator Newman. Senator Ruff. Senator Vogel. Senator Barker. Senator Edwards. Senator Deeds. Senator Locke. Senator Peterson. Senator Marsden. Senator Eben. Senator McClellan. Senator Howe.
Aye.
Twelve ayes, 1 nay, 2 abstentions.
12 ayes, 1 nay, 2 abstentions. The bill is reported. Now, we have 2 bills that are on a similar topic that I would like us to consider jointly. The first is Senate Bill 5014, Senator Edwards' bill, and this other one is Senate Bill 5113, Senator McDougall's bill.
Madam Chair, Senate Bill 5014 has a substitute. I'd like to move that the substitute be adopted.
It's been moved and seconded that the substitute for 5014 be adopted. All in favor, please say aye.
Aye.
Any opposed? It's adopted.
Madam Chair, what the substitute does is solve some problems that people had raised to clarify what the bill has to do with. It has to do with the Crisis Intervention Team program, making it statewide. And it provides establishing a compulsory training standards for basic training and the recertification of law enforcement officers to include crisis intervention training in accordance with the code. There are three categories here. First of all, it provides for a module, number one, a module of principle-based training to be included as part of the compulsory minimum training standards subsequent to employment for all law enforcement officers. Second thing it provides for is a module of principle-based training to be included as a part of the basic training of and of the recertification requirements for law enforcement officers. And three, a comprehensive advanced training course for all persons involved in the crisis intervention team programs. Every locality shall establish or be part of a crisis intervention team program in accordance with revisions of the code here. I think this should clarify things. Just from what I understand from Charles Quigliotto, who's up there somewhere, that this should solve the problem that had been raised by a number of people. It should clarify the intent of the bill, which should address the fiscal concerns raised by the state police. The intent is not to provide CIT training to all sworn law enforcement officers, but to provide some basic understanding of CIT principles to all law enforcement so they can better respond to a variety of situations. At the same time, it maintains the team approach. Like 2/3 or so of localities have this team approach, and it's very important to keep that in place. And as I understand it, this should have no fiscal impact as far as I'm aware. That's what I've been told. So with that, move that the substitute pass. I'll be glad to answer any questions.
Are there, let me, because they're on the same topic, see if Senator McDougal wanted to add anything.
Thank you, Madam Chairman. Madam Chairman, I think when this started out, the approaches that Senator Edwards and I took were different. I think Senator Edwards focused on the initial training for a law enforcement officer, where I was more focused on the continual training for officers, and the approach that we took dealt specifically with the financial ability of departments to be able to provide this training. I don't know that Senator Edwards, I was not provided a copy of his substitute until it just came up on LIS. I don't know that his dealt specifically with the financial side, but certainly putting in place training for officers on a continual basis is an extremely important goal and one that we should try to promote.
Thank you. I totally agree with you on that, by the way. I'm wondering if, before we adopt the substitute, we could have a motion to roll Senator McDougal's bill into Senator Edwards' bill with co-chief patrons. It's been moved and seconded. All in favor, please say aye. Aye. Okay. Now we have the substitute itself, the substance. And I believe it's been moved. Yep, it's been moved and seconded that the substitute be adopted. All in favor, say aye. Aye. Any opposed? Now, is there discussion on the bill as the substitute bill? Is there a motion?
I move the bill pass.
It's been moved, and is there a second? Seconded that Senate Bill 5014, which has Senate Bill 5113 rolled into it, that it passed the committee. All in favor, please say aye. Are there any noes? Okay, good. Thank you. See, the one remaining bill is Senate Bill 5066. Is that right, staff? That's the remaining bill? Yeah. The remaining bill is 5066. Senator Cecil.
Madam Chair, 5066 is the presumption bill. It started out with just the firemen, and the presumption would be that you got if you came down with COVID, it was a function of, where you work and what you do. Along the way, it picked up healthcare workers, and it should have, particularly those who work in hospitals as doctors and nurses. It also picked up teachers who teach more than in person, more than 2 or more days a week, and prison guards and local police. The bill is really needed. The problem is it does carry quite an expense for some of the local governments. So, that's essentially what it does. Like I said, it's a presumption bill dealing with COVID-19. But, I explained to you all who is in the bill. It does carry a local price tag, which we've been unable to determine exact amounts. I don't think it'll bankrupt governments, but it is, you need to know in all honesty, it does carry a price tag.
Okay, are there questions for Senator Saslaw?
Madam Chair?
Yes, Senator Marsden.
Senator Saslaw, does this bill include regional jail individuals? I know it covers sheriff's departments and who handle local jails.
I don't think it does. I mean, there's been, every time I turn around, there's a substitute being drafted, but I don't think that's the case.
Madam Chair.
It does not, we're being told by staff.
Madam Chair?
Senator Pugh.
Just speak to that if I may. I know the price tag on this is going to be enormous, and that adding regional jail personnel to that would increase local costs as well as, I'm sure, state costs. But it seems inappropriate to leave them off of this particular bill. And Madam Chair, would it be, Madam? let her finish. You do? Madam Chair, I believe Senator Edwards has an amendment on that.
The clause is good.
Madam Chair, I have an amendment that solves that problem. The amendment simply provides that to insert a new provision on line 60 of the substitute. Insert regional jail officer means. In other words, we cover regional jail officers, I guess it's line 43, and then there's a definition on line 60. A regional jail officer means superintendent or jail officer of a regional jail authority or jail board who has taken the oath required by such and such. And number 2, a superintendent or jail officer of a regional jail or jail farm who has taken the oath. Madam Chair, it's my understanding that there are about 3,800 sworn regional jail officers throughout the state, and regional jail officers do qualify for line of duty benefits, which are paid for by the jails and localities, and are under VRS. The state contributes its share along with the jail and the localities, but again, the jails and locals pay the workers' compensation and LODA benefits, not the state. And so I believe the committee staff knows how the regional jails are funded, but I believe this would solve the problem we're talking about. And I think there's some people here who maybe would like to speak. Superintendent Greg Winston of the New River Regional Jail, which is my jail,
Senator
is prepared to speak.
Edwards, Senator
Yes.
Edwards, we're not taking testimony.
Okay.
Madam Chair.
Anyway,
So you have an amendments to the bill. Would you like to move them?
I move the amendment.
Is there a second? Second. It's been moved and seconded. The amendment be agreed to. All in favor, say aye. Aye. Any opposed? Okay. So the amendment's agreed to. Now we're on the main bill.
Yeah, I don't have the substitute, Madam Chair.
Oh, I'm sorry.
Is that on LIS?
Can we adopt, is the amendment drawn to the substitute or the?
Yeah, I believe it's adopted to the substitute, it's my understanding.
Okay, so let's adopt the substitute. All in favor of the substitute being adopted, say aye.
Aye.
Aye. Any opposed? Okay, and now let's vote again on the Senator Edwards amendments. All in favor of that amendment, please say aye. Aye. Any opposed? Okay. So,
Madam Chair,
yes, Senator Newman.
if ever we had to know how much, it's this one. And as I understand it, we're well over $100 million as currently constructed, and I guess I just don't know where that's coming from. I mean, clearly it's a well-meaning item, but I just don't know how we pay for it. I mean, if this was a normal session, we'd put the clause on it and figure out how to pay for it, but I don't know how to pay for it, Madam Chair. It just, I mean,
Madam Chair, it's my understanding that regional jails
Senator
and their
Edwards.
members would fund the workers' compensation benefits, not the state.
Madam Chair, I'm not interested in the amendment. I'm worried about the bill. So my concern is about the cost of the bill. I think Senator Edwards' amendment is on it and pretty securely in the bill.
Madam Chair. Oh, I got it.
Madam Chair.
I actually share your concern about the cost and how uncertain we are and how we don't know whether or not we're going to be getting additional federal funds that might help us with something like this. But this is a lot of money for right now.
Madam Chair.
Senator Norman.
Madam Chair, I have an amendment, and that would be to add the clause to the bill.
Senator, let me check with staff, but we have not been adding the clause to the bill, to any bills.
Madam Chair.
Madam Chairman, I withdraw my motion.
Thank you.
Okay.
Okay. Senator Lucas.
Madam Chair.
Madam Chair,
Senator Lucas.
could we just pass that by for the day?
Okay. Senator, thank you. I'll keep that. Senator, anybody else?
Madam Chair, I was just going to make a comment.
Okay, Senator Peterson.
Madam Chair, I think it's important to look at this very closely. Not only is this would be a massive cost that we would be placing on local governments, it would also basically be as far as I'm concerned, if we pass this, we wouldn't have in-person instruction this year because just the way this bill is, you couldn't get insurance for your school employees. And I think that's a policy decision that I'm not ready to make right now. So I really think we need to put this on the sidelines for a bit.
Thank you. Anyone else? Okay, Senator Lucas. Move to pass by.
Move to pass by for the day.
Is there, and it's been seconded.
Second.
Further discussion? All in favor of passing it by for the day, please say aye.
Aye.
Any opposed? No. 2 noes. Is that 3 noes? The usual 2. Okay, 2 noes. I believe that completes the docket. Is that correct? Good. Okay. So I'd like to thank everybody for being here today. We saved sort of the toughies for last, so good work. We're going to be having additional meetings scheduled for the budget itself, but we will not be hearing any more Senate bills in Senate Finance. Okay. And if there's no further business, we're adjourned.
Madam Chairman, when will we start on the budget?
We don't know yet.
Don't know. Okay.